We're very happy that just after her first interventional therapy, she can already eat and talk. We are very grateful for your hospital. Because of you, given her second life. And then the second PET scan was after she had received 4 treatment cycles already. The result is really great. Some of the tumors were almost gone already. We're very, very happy of the result and we're very thankful.
I'm Heyzel Go from the Philippines. I'm 70 years old. My type of cancer is non-Hodgkin's lymphoma. September 2024.
She thought because she's having a hard time swallowing and also breathing, so we went to the ENT, and then that's when we found out that she has a tumor under her tongue. We have the tumor biopsied, and then that's the time we found out that it's really cancerous. We did not consult a local hospital for the treatment plan because we don't want her to undergo the systemic chemotherapy. We know that 80% of her airway is already blocked by the tumor. If we undergo the treatment, maybe it will reach to a point where she cannot eat and breathe already. My husband's father was a patient here. That's why when my husband found out that my aunt had cancer, he suggested that we should do the treatment here. Maybe because my husband's father really got rid of cancer, so we're thinking that maybe she too will get rid of the cancer. That's why we directly consulted your office in Manila. I know that she will be treated well here.
Interventional and targeted chemo.
After just the first interventional therapy, she can already eat just right after when she was allowed to eat, and she can also speak. We can tell that it's really effective. The treatment is really effective. I think the advantage of the minimally invasive treatment is that after the treatment, after the cycle, she can go on with her life. Like in her case, she has a store. She's the one managing the store. So I think if she underwent the traditional chemotherapy, after the cycle, she will not be able to manage the store because she needs to be isolated in a clean room and stuff like that. The doctors and nurses and the staff here are very professional. They check the patient every day, talk about the results of the tests, and talk about the treatment plan. The patient is well informed. Maybe language barrier is one of the primary concern, but we know that you have interpreters. I think that's not a problem. She participated in the Beijing Road Tour and then the International Women's Day. I think it's very helpful for patients because they feel that they are welcome or important also. I think that's a very good program. Since we found out that 80% of her airway was already blocked by the tumor, we got really worried that if she cannot get treated here, she will not be able to eat or breathe. We're very happy that just after her first interventional therapy, she can already eat and talk. We are very grateful for your hospital. Because of you, given her second life. Thank you very much. Especially during the last cycle, she had her PET scan. There was a comparison between the first PET scan wherein she hadn't received any treatment yet, and then the second PET scan was after she had received 4 treatment cycles already. The result is really great. Some of the tumors were almost gone already. We're very, very happy of the result and we're very thankful. Thank you. Actually, we have notion that Chinese people are like strict. That was also one of our fears coming here. When we arrived here, we were warmly received by the nurses and the doctors and the staff. And actually, Chinese people are really friendly. So don't hesitate to come here and receive your treatment. Also, the result of my aunt is really good. I would really recommend this hospital because my aunt will get rid of her cancer. You too can get rid of your cancer.
kamo nga naay mga sakit nga cancer, sa unsang klase sa cancer, ari mo diri sa China sa Modern Cancer Hospital sa Guangzhou kay maayo kayo ang ilang treatment. Matabangan mo nila nga mamaayo jud mo.